Water bottle. All right, good afternoon everybody. In a moment I'll hand over to the Director General of Health to give an update on the case investigations around our most recent community cases. I am very pleased to report that there are no new cases detected in the community or in our managed isolation facilities from the test results that were processed overnight. Once the Director General's given the daily update, I'm going to give you a bit more of an update on what's happening at the Pullman Managed Isolation Facility and then a few other points from me about the decision-making process moving forward, and then we'll open up for questions. Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So as the Minister said, I can confirm that there are no new cases in the community to report at this point, and we had no cases in managed isolation identified in the last 24 hours. Before I move to the Auckland February cases, I do not want to note that we are also formally recording the sad death of a patient with COVID-19 at North Shore Hospital, which we first announced on Saturday the 13th of February. This death has now been included in our official COVID-related death numbers, and so a total of 26 people have now died with COVID-19 in New Zealand. I continue to offer my deepest sympathy to all those affected by COVID-19 and request the privacy of this family and others who knew this person is respected. Now, for an update on the Auckland February cases. The 3 positive cases remain in quarantine at the Auckland quarantine facility, and their household contact is under supervision isolating at home. Our intensive investigation around the potential source of transmission for all 3 cases continues. We have a number of scenarios we are pursuing. Now, as I've said before, it's important we don't jump to any premature conclusions about the source of these cases. And I want to thank the people involved, these 3 people and their contacts, for the excellent information they are contributing to the picture we continue to build. These cases have resulted in a testing surge, and from the 5,818 tests processed nationally yesterday, and which we are reporting on at this point, it's encouraging, very encouraging again. There have been no positive results, and I should say that those test results were up to around midday today. We had no further positive results. Nationally, more than 15,000 swabs were taken yesterday. The results from those tests will continue to be processed over the next 24 to 48 hours, and they will help to inform our actions and, of course, our advice. Just a regional breakdown on those figures. Across the Auckland region, over 10,500 swabs taken yesterday, and there's been additional capacity added to the existing clinics with pop-ups today open at Takanini, Botany and Papatoetoe. As at 11:15 this morning, a further 1,454 swabs had been taken across Auckland. I do want to thank the hard-working staff at these facilities, and as an additional safety precaution, there is a number of infection prevention control processes in place around queues with queue management for the number of people who are turning out. And I do want to also thank general practices and other clinics across Auckland and indeed across the country that have continued to undertake swabbing. Elsewhere yesterday, Taranaki reported 450 swabs, Waikato 750, and there were 260 in Northland. One crucial but sometimes overlooked piece of work is our ongoing cooperation with ESR around wastewater testing in places of interest in Auckland. Now, ESR started this in the middle of last year, and they have continued to refine their methodology. Wastewater testing can detect even a single person who may be shedding the COVID-19 virus. Such testing has got increasingly sensitive and will help to detect any potential infection in the community. The more we sample, the more likely we would pick up something if it was there. And we have initiated daily wastewater testing, which was already underway in Auckland. We have initiated that this week in New Plymouth and in Hamilton. There is a specific site in Auckland that captures the Papatoetoe area. There is a 48-hour lag in reporting, but so far the results have come back negative, and by tomorrow, of course, we will have that important testing from Monday. Contact tracing inquiries have now identified 109 close contacts outside the household. This increase in number is predominantly because of a very precautionary approach to people classified as close contacts at a new location of interest, which was a medical centre waiting room where the father wasn't in the red lane for COVID testing. This was well before he developed any symptoms or indeed tested positive. In addition to the family member close contacts, all the workmates of the father and the people that travelled in the car to Taranaki have tested negative, and there are 14 negative results from the close contacts at Papatoetoe High School out of 36 there, and they will continue to come in during the day. More than 2,000 other contacts have now been identified as Casual Plus and loaded into the National Close Contact Tracing System. This includes people who were at the workplaces of cases B and C, others from Papatoetoe High School and other locations of interest. It's a large number of contacts, and obviously our National Contact Tracing Centre is at full scale supporting Auckland Regional Public Health with surge capacity. There's also, of course, ongoing interest and investigations at Sky Chef as a key workplace here. I mentioned yesterday that we had commissioned an infection prevention control of the laundry process there. That was undertaken as part of the follow-up investigation related to Case B. Overall, the early report is that IPC audit identified that the practices there were very much in commensurate with what we would expect in relation to the health and safety management. There were a couple of small improvements suggested, but they do not impact on the overall assessment there, and that they are appropriate for the workplace, that is the infection prevention control measures. And I want to once again thank this employer, which has been exceedingly helpful and supportive throughout. Finally, regarding testing, as I said yesterday, we took more than 15,000 tests yesterday. This is a great response and exactly what we need, and a reminder that those who don't have symptoms or were not at a place of interest do not need to be tested. Anyone who has been tested because they were at a place of interest and has returned a negative test is now able to go about their daily lives, but of course be aware of symptoms, and if you do develop those, please isolate and seek a test. If you want to find out where to get a test, the very best place is the HealthPoint website. That's healthpoint.co.nz. It has up-to-date information on more than 1,100 testing sites right across the motu, including most GPs. If you look at that website, it means you don't have to call Healthline to find out where to go, and in fact, Healthline has increased its capacity tenfold over the last 24 to 48 hours. But I do want to point people to information either at the HealthPoint website around testing or general information on the Covid-19 government website, so that people who need health advice can get through to Healthline. I also just want to finish on a note of thanking the many New Zealanders who provide very nice messages of thanks to the staff working at our MIQ facility. I received an email yesterday that was extremely appreciative of the work done by defence staff, the nursing team, hospitality and hotel staff at one of our facilities, working to, in their words, protect New Zealanders every day. I share that sentiment, and I dare say that it's feedback like this that really does keep the teams going and doing their best to provide not just excellent service for their guests, but to protect all their fellow New Zealanders. Thank you, Minister.
Thank you, Dr. Bloomfield. And if I could also echo the government's thanks to all of our frontline border workers for the incredible contribution they are currently making. A quick update on the Pullman Managed Isolation Facility. This morning the Pullman did begin receiving its first guests following its recent shutdown. This follows an intensive deep cleaning process, a thorough investigation by health officials, and some changes to the way the Pullman facility will operate in the future. We've been very carefully considering the health and well-being of returnees and staff at this facility as we have made those decisions. The facility is initially reopening at 50% of its capacity for the first 2 weeks, and only the lower floors will be occupied. That will allow us to limit the use of lifts within the Pullman. Whilst that is happening, the air filtration systems in the lifts are being upgraded and replaced. That work is expected to be completed later this week. The CCTV upgrade is now complete, and new strict procedures have been implemented that limit people's movement around the Pullman facility. Corridor ventilation will now operate 24 hours a day, significantly reducing the risk of airborne transmission, and protocols are being implemented to control the airflow out of individual rooms. The pre-departure testing and the day 0/1 testing that we have now implemented will also help to reduce the risk of COVID-19 cross-infection within any of our managed isolation facilities. I can also confirm that the lessons learned from this experience and the changes made at the Pullman are being rolled out across the wider MIQ system. The Pullman has been a very important part of our MIQ system. It's received consistently good feedback from returnees, and it will be good to see it returning to full capacity soon. I do want to finish today with a reminder of what Cabinet considers when it comes to any decisions on alert levels in New Zealand. The framework was agreed by Cabinet last year. It's the same framework that we have applied to all of our alert level decisions since May. The first thing that we get, and we always do it in this order, is the advice from the Director General of Health and from his team around the ultimate health risks that we are dealing with. Cabinet considers that advice along with evidence around case numbers, contact tracing, any geographical distribution of cases, including whether that spans across regions, and any connections to the border. We also consider the effects of any change on the economy and society more broadly, including the impact on any particularly at-risk populations. Finally, we consider whether the alert level changes, or changes to alert levels, can be operationalised safely, and the timeframe in which that can occur. So we'll provide more of an update on those considerations around about this time tomorrow. We don't have a confirmed time for when we will make the decision. That will partly depend on the information that we receive in the next 24 hours. Finally, before I open up for questions, I do want to note that it's a Parliament sitting day, and I'm due in the House at 2 o'clock to answer 6 parliamentary questions today, so we'll try and keep this reasonably tight today, but we will provide further updates. There's more information. Jessica.
What do the zero results today mean for our chances of coming, or Auckland's chances of coming out of level 3 tomorrow night?
Too soon to speculate, but a day when we get zero positive test results is always a good day.
We're reading a lot into today, though. There were a lot of testing from the school and from the workplace, so this has got to give us a little bit of a sense that we're on the right track.
Yeah, so as you will have heard from the Director General's update, a number of the swabs taken yesterday, we still haven't had the results back from yet, but the results back that we have had are encouraging. It's good to see, no new positive cases today. Tova.
Is there any update on the potential changes to the frequency of testing border workers, including those peripheral border workers, and the fact that you're even considering those changes, does that suggest that there were flaws in the system?
No, we learn as we move along. At the time we put those testing requirements in place, they were appropriate to the risk that we were dealing with. What we've seen in recent months is that we're dealing with a higher level of risk now as a result of variants that potentially can spread faster and infect more people. And so we have to consider whether we adjust our settings according to that. Now we haven't just started doing that, we have been doing that since the beginning of the year, and you'll see that with the pre-departure testing, the day 1, day 0 testing that we've been doing. We've been making changes as we've been going along. What we will also look closely at is whether there are any other groups on the periphery of the border that should be brought into the compulsory testing regime. You'll see from our experience now that the laundry worker concerned and her workmates were being tested regularly, though they were not required to be tested. So one of the questions that we will be turning our minds to is whether that should be changed. Now, I do want to sound a word of caution. Tens of thousands of people do interact with our border each day, and so we have to make sure that we're getting that we're drawing the line in the right place as to who needs to be tested. So if you consider the port, for example, goods flow across the port all of the time. Similarly, freight flows through our airport all of the time. Not everybody who is involved in that process is going to be at risk. So we have to always look at how we can continue to refine that.
And saliva testing companies say that claims about saliva tests not being as good as nasal swabs are incorrect. What's the evidence that you have, and perhaps this is for Dr. Bloomfield as well, about saliva tests that make you concerned and reluctant to use that type of test more widely?
I'll make a quick comment and then I'll ask Dr. Bloomfield to comment on the science. One of the things we do know about saliva testing is that it still requires the same resourcing to process those test results as our PCR tests, but the overall confidence in each individual test result is lower than with PCR. PCR is still around the world regarded as the gold standard test. So we have to consider carefully the impact on our workforces of being more regularly tested, on the capacity to process all of those tests and what that would ultimately mean, and whether that increase actually gives us an extra layer of reassurance, given that we know we'd be more likely to get more false negatives from the saliva testing. So we are doing some saliva testing now. We had begun that before we dealt with the Pullman issue. It was suspended for a brief period of time while we dealt with that. That has resumed now. We're obviously looking very closely at what we learn from that sort of early stage rollout of saliva testing as to whether we want to expand that further. So that's still in its early stages. I'm not going to rule out expanding saliva testing. It would be as an addition to our existing testing regime, not as an alternative to it. But I'll ask the Director General to comment on the science and the validity of the test results.
Just two additional comments. First, I wouldn't say we're reluctant to use it. As the Minister said, we are actually trialling it in a number of our quarantine facilities around the country. I think the second point here is the data we have been, first of all, not all saliva tests are the same, so some are better than others. The data we've presented on the one that there is a company wanting to use here in New Zealand is from North America. We would need to validate that in the New Zealand setting, just as we did with PCR testing at the outset, and that's what we want to do.
I'll come to Jane.
Are you happy with the level of scanning generally? Obviously it goes up, when we have these alerts, but we had Countdown this week saying that some people were just flat out refusing, and they actually said that they would support mandatory scanning. Is that something that you're looking at, given it's such an important part of the response?
One of the reasons that I have been hesitant, I've been looking at this all the way along, is the potential compliance costs that creates, particularly for small businesses. But we will certainly be looking at how we can encourage greater uptake, and I'm not ruling anything out at this point.
Is it something that you can give to businesses? I mean, in that particular instance, the business was trying to enforce it and they had nothing to, enforceable to back them up. Is there something other than a blanket mandatory, rule that you could give businesses to help in that situation? I mean, is there an interim or...
So like I said, that's something that we're looking at, how we can encourage greater uptake, what more tools we can give businesses to encourage people to do.
What sort of thing?
Look, we look at experiences from around the world where they might have, roving groups of people walking around to encourage scanning uptake. That eases some of the pressure on businesses to have to do that for themselves. Bigger businesses do have the ability to do that. So supermarkets are well placed to have someone at the door encouraging people to scan in. And I want to thank those supermarkets that are doing that. For smaller retailers, where they may only have one or two people working at any given point in time, that can be quite a big challenge for them. So,
Then that you're not happy with the level of scanning, like overall, not just...
I haven't had the numbers in the last 24 hours. What we do know is when New Zealand responds well when we're dealing with COVID-19. We don't necessarily prepare well. So when we're in a position where people are feeling comfortable, they're not always good at taking those precautionary measures. But when we ask New Zealanders to ramp up because we're responding to something, Kiwis are pretty responsive to that. Now, I imagine that we will see quite a significant spike in our scanning numbers and then it will tail off again as the risk decreases. So the key thing, as we get the numbers up again, which I'm sure we will in the next sort of 48 hours or so, we want to keep them up there, and so we'll be looking at what we can build into the system going forward. Audrey.
Dr. Bloomfield, can you just clarify your reference to 2,000 casual plus contacts, and will the tests of them be known when Cabinet meets tomorrow?
Yes, so that includes the non-close contacts from Papatoetoe High School, so the other students who weren't in the same class, plus whānau members. It includes also the people who have come forward because they were at a place of interest, of which there are quite a number. So that's the total there is over 2,000, and most of those are all ones that have been registered and being tested, and so those tests will be being processed today. So yes, it'll be important to have those results back to inform my advice for tomorrow.
Jenna.
Just on the places of interest, Dr. Bloomfield, you mentioned the medical